To be with you and your viewers, Matt.
Here's Mona.
Thanks, Matt. More now on the new coronavirus cluster. The number of cases in Sydney has risen sharply overnight to 17, with all of them linked to the Northern Beaches cluster. New South Wales Health is urging residents in the area from the Spit Bridge to Palm Beach to stay at home for the next 3 days. Avoid aged care homes and hospitals, avoid unnecessary gatherings, stay away from restaurants, places of worship and gyms, and keep to household groups. Now, it comes after thousands lined up for testing yesterday, with authorities warning that numbers will rise even more today. And New South Wales Premier Gladys Berejiklian joins us now. Good morning to you, Premier. Thanks for your time. All eyes are on you and on your state. Cases have absolutely exploded. How concerned are you about this outbreak?
Oh, look, I'm absolutely concerned, as we all should be. This is a very critical and concerning situation given the number of cases we have and the concentration of cases. I can assure everybody that our health authorities are working overtime, and what is really, really essential is for people to follow the health advice. If you live on the Northern Beaches, please don't leave home unless you absolutely have to. Please don't mix with other households. Don't frequent any venues unless you absolutely have to. At this stage, there are obviously guidelines and directives that we're offering or suggesting from health, and we are grateful because the community on the Northern Beaches has responded very positively to the advice we've been providing. We set up about 6 pop-up testing stations yesterday. Thousands of people, as you mentioned, came to get tested. I am asking people to brace themselves today. We are going to see more cases overnight, no doubt about it. I'll be providing an update with Dr. Chant and the Health Minister later in the day. But I want everybody to brace themselves. We are going to have a considerable amount of cases, I think, come during the day. And that's because people have come forward to get testing. We know the main event where the disease spread was on that 11th of December at the Avalon RSL, and then subsequently at the Bowling Club on the Sunday were the 2 main events where the disease spread. But can I also suggest very strongly that nobody across Sydney should be going into any venue where there's no QR code. Even people across Sydney should really be thinking about what they're doing and where they're going, because we know that some people from the Northern Beaches have been venturing out of their communities into other areas, and there could have been what we call seeding events in other communities. So it's really important for all of us to be on high alert. With the mildest of symptoms, please get tested and isolate until you get the results. And of course, also follow the health advice. There have been a significant number of venues that have been added to the list overnight of where some people who have the disease have actually been. If you've been to any of those venues, please go get tested, isolate until you get the results. It's really, really important. We want people to have a good Christmas, but we know that this is really unfortunately disrupted many plans. And over the next 2 to 3 days, obviously it will be extremely critical. The next 48 hours will be critical. And what we mainly want to ensure is not to have what we call those seeding events. We don't want the disease to spread more broadly throughout Sydney. So we're asking everybody just to think about what they're doing, to monitor their behaviour. Have you been to the Northern Beaches? Have you been with friends who've been to the Northern Beaches? Please think about those things. And if you are moving, if you do have to move in and around the Northern Beaches community for essential reasons, please wear a mask. Don't catch public transport today and the next few days unless you're wearing a mask. Don't go grocery shopping unless you're wearing a mask. Don't go to a place of worship unless you're wearing a mask, and that's across all of Sydney. So whilst at the moment the number of cases are mainly from the Northern Beaches community, we are concerned that seeding could have occurred in other parts of Sydney, and that's why it's really important for all of us to be on high alert.
Yes, indeed. All right, Premier, let's just knuckle down on what the situation is right now. What are the numbers from overnight? How many more cases have tested positive?
Well, look, I did get some updates from Health this morning, but we'll be providing a fulsome update at 11 a.m. this morning, Monique. I can tell you that.
Sorry, Premier, to interrupt you. So sorry. Just give us a ballpark. You know, well, are we talking in the tens or more?
Look, I should ask the community to brace themselves for a number of cases today that will emerge, and of course we'll provide that update at 11 a.m. But in the meantime, we're asking everybody to please follow the health advice. Please make sure if you live on in the Northern Beaches community, you really restrict your mobility. We don't want people moving around unless you absolutely have to. But all of Sydney should be on high alert. You may have been in contact with someone from the Northern Beaches, or someone who's been in contact with someone from the Northern Beaches. So everybody needs to be on high alert. And our aim is to really get on top of this as soon as possible so that people can have a less disruptive Christmas than otherwise. We really want people to be able to enjoy loved ones and family over the next week. But that will be dependent on how we go the next few days, and that's why it's really important for us to get on top of this as soon as we can. We also do know and understand from the genomic testing that the actual original source was from an international source, but obviously somehow it's got from the international source into the community.
OK, so we don't know how it has got into the community yet. Have we identified patient zero?
Look, I wouldn't describe it so much as patient zero, but certainly the genomic testing has told us the type of strain it is, and we know that it's linked to an international case. And Dr. Chant will have further information for us in the morning. Obviously, the situation is developing. Can I please thank our contact tracers and genomic tracing experts? They've been phenomenal working through the night. Many of them haven't slept. Many of them have made sure they've contacted everybody, contacted the venues. And this has also demonstrated to us how important it is for businesses to have QR codes. Can I say some businesses were fantastic, others were slack. And that makes the job harder when most businesses are doing the right thing, but a few aren't. It really makes health have to work double hard just to get those contacts. Yes, all right. Now, Premier, we know you have to go, but just very quickly before you go, your reaction on the border decision so far. We know WA, Queensland, Victoria, Tasmania and the Northern Territory have all imposed new restrictions. Western Australia has ordered that anyone from New South Wales since December the 11th has to self-isolate, while in Queensland we're seeing that it's just restrictions on people from the northern beaches. Your reactions to that? Well, look, I think the proportionate response would be absolutely to have some type of response to the northern beaches. I think the northern beaches we can categorise as a hotspot at this point in time. And I'd ask state premiers, obviously, to take the precautions they think are necessary, but don't close off people from all of New South Wales coming into your states. Please consider making it a proportionate response. But there's no doubt, if this situation had happened in another state, our health experts would be saying to me, anybody coming from a hotspot into New South Wales would need to go through a different set of circumstances. So I completely understand that. All right, well, New South Wales Premier Gladys Berejiklian, you've got a big day ahead. Thank you very much for your time. We appreciate it. Thank you, Monique.
The Premier quite reserved there, Monique, on how much information she would reveal, but we've been told to brace for a considerable number of new cases, which is quite worrying. It's going to be a lot. The other big revelation for me was that this has come from an international source, which could only point to a flaw in our monitoring or security systems, because otherwise we had it under control domestically. This is our worst fear, that it would come from an international traveller and then be distributed through the community. This is greatly worrying. And now we have to just trust what the Premier says, that our contact tracers will get on. This is exactly what they have been preparing for, and Health has been preparing for, to just lock down those areas. But really, it seems extraordinary that it takes for this to happen for us to say, OK, and we'll change X, Y and Z. Why that isn't happening Look, it's a difficult situation, but the other big concern for me was, have we found patient zero yet? And the Premier was still a little bit circumspect.
It sounds as if they have, knowing that it comes from an international source. Anyway, we'll find out more when she gives her briefing a little bit later today. But right now, here is Eddie with the rest of the day's news.
Thank you, Mon.